talking the other day about the TENS unit for my adult patients that I care for at the hospital. And you were sharing with me that you've been using TENS therapy with Damien for a really long time.
Yeah, it's been about a year or so, maybe a little over a year, because you talked to me about the TENS unit and how it helps with pain and discomfort. Mm-hmm. And Greg started using it for his back pain, and then we kind of said, I wonder if this will work for Damien. Mm-hmm. So he just gave it a try one day, and we noticed that he has a lot of tension in his feet. Mm-hmm. And he was able to get his feet much flatter when he was walking. Mm-hmm. He just seemed also more centered, a little bit more grounded after he does the TENS unit. Mm-hmm. Sometimes when his energy gets a little scattered, mm-hmm. I think it's at times just he's feeling some discomfort. Yeah. And there's something about the TENS unit that actually seems to ground him a little bit.
Yeah, wow. I noticed too that, I know what it did for me, so I can only imagine it probably having the same effect for him. Mm-hmm. So.
And it's interesting because I would never really make the connection about the use of TENS in a toddler, right? So Damien here, my good buddy, is 3, and I automatically would think it would be a bit challenging to try and utilize something like a TENS unit for a toddler.
Well, you see, he's showing the challenges. So this is part of it, especially in the beginning when about a year ago, he was a little over 2, and it's, Damien, don't pull the cords, don't pull, you see where Greg's putting them now. Greg,
underneath
talk a little bit about where
I hook them on the back side of his legs. Sometimes we do the feet, sometimes we do the back, mm-hmm. and kind of rotate where we have them at. But I try to keep the cords underneath him and pulled away from him. Mm-hmm. And once we get it all hooked up and ready, we switch over to the iPad. It keeps him entertained for 30 minutes, mm-hmm. and keeps him focused on that to where. And you can start seeing his little toes twitch, and you don't turn it up like me. I go max. Mm-hmm. Him, I go minimal. Mm-hmm. But I can start seeing the reaction in his feet.
I think that's key also, because I've used it when I've had back pain, mm-hmm. and even just 2 or 3, it feels like a lot for me.
Like a lot of stimulation.
A lot of stimulation. And so for Damien, we've done it on like the 1.
Yeah. Mm-hmm. And there's sometimes, it depends on which one we're using. Mm-hmm. I go up a little bit higher, but I let him kind of dictate mm-hmm. what that level is. Because some days he has great days where it's like, I can turn it up a little bit. Mm-hmm. Some days he's like,
And I think that's so important that you guys are keyed in to his response as you're making adjustments to the unit.
Yes.
Because when we're recommending TENS units for adults, we'll always say to patients, this is a self-care intervention, listen to your body.
Yes.
So for Damien, it's really, it's a joint venture.
Yes.
Right? So he's letting you know how he's feeling, and then you're paying close attention to what he looks like and his response.
And you already see he's hooked up. Now he's ready to watch.
Mm-hmm. and which one are you putting it on? Are you doing the acupuncture? That was actually how it started. We were looking for an acupuncturist because Greg had read something about acupuncture for cerebral palsy, mm-hmm. and trying to find somebody that does it for toddlers was really challenging. Mm-hmm. And he remembered, I remembered that there is a setting.
Yeah, so it's got a lot of different settings. So I go back and forth between the kneading, scraping, and acupuncture. Mm-hmm. So I do both legs. And then, because he likes to push buttons, like most toddlers, mm-hmm. it has a locking function.
The locking function, that's important.
That's very key when you're looking for these for toddlers. Because right now, he can push all the buttons he wants to, and not going to do anything. It's locked out. So,
but Damien, you say bye-bye?
But here.
Bye-bye.
Today we are talking about a TENS unit, or transcutaneous electrical nerve stimulation unit. This is a device used to alleviate pain through electrical stimulation. TENS units are thought to relieve pain by blocking the pain signal sent from the brain and stimulating the production of endorphins. Now, these are our body's natural painkillers. The device works by sending low voltage electrical impulses through adhesive or sticky electrodes that are placed on the skin either over or around the area of pain. Those electrodes are connected to wires, which are then connected to the actual TENS unit, which is either a rechargeable device or sometimes powered by batteries. TENS units are commonly used for various types of pain, including chronic pain, arthritis, muscle strain or sprain, and even post-surgery discomfort. They can be used at home or in a clinical setting, such as a hospital or a clinic. The person using the TENS will usually adjust the setting on the device, which will include things such as intensity or the strength of the stimulation, frequency and or duration of the electrical impulses, and in the user being able to make these adjustments, that really allows for a customizable experience based on the individual needs of the person using the device. Now, there are some very important safety considerations when using a TENS device. Although TENS therapy is generally considered safe, and many professional organizations and professional providers and disciplines have endorsed the use of TENS as a non-medicine, or we call a non-pharmacologic approach to pain control, having very few side effects. There are a few groups of people who should not use this device. This would include people with seizure disorder or epilepsy, implanted devices such as a pacemaker or implanted defibrillator, or other medical devices such as an insulin pump or implanted medication pump. Women who are pregnant should absolutely speak with their OBGYN before considering the use of a TENS unit. In addition, if you are a caregiver for an individual who has dementia, or an individual who is not able to share how they're feeling or to verbalize what's happening in their bodies, such as a young child, maybe an infant, a young child, or someone who has cognitive challenges, if they're not able to share with you how the TENS unit actually feels when it's applied and turned on and when the settings are being adjusted, this is not the right intervention for them. There are other things out there, but a TENS unit can only be used by an individual who is able to feel the sensation coming from the electrodes and respond to that sensation. So if the sensation is too high or uncomfortable, they need to know that those settings need to be turned down. The electrodes can only go over intact skin, meaning that if you have an open wound or a very bad skin irritation, the electrodes should not be used on that area. They are only applied over intact skin. If you have had surgery, so we discussed the idea that the TENS unit is very helpful for pain after surgery. Talk to your surgeon about their perspective on the use of a TENS unit and never apply a TENS electrode over the incision. Key recommendations say if you're using it in post-surgical pain, the electrodes go about 2 inches from the actual incision. As with any pain-relieving intervention that you may be considering, please discuss with your healthcare provider before you use it. Remember, any pain in your body could be a signal that something may not be quite right. Always have your healthcare provider investigate any new pain or change in any chronic pain condition that you may have. Once you've been assured that you are safe to explore these alternative pain relief interventions, you may find, just like many of my patients, that a TENS unit can be a really helpful tool for the management of your pain. For a general review of how to use a TENS unit, you can check out my other videos. Thanks again for joining, and have a joyful